Welcome, everyone. I am Gio, your host for the Ask an ECV Expert series of talks. I am here today with crisis psychologist Sam Bernard. We will be covering how COVID-19 impacts human psychology. To make our process as smooth as possible today, given the amount of material we're covering, we will sort of cover a series of topics, which I'll outline briefly to give us kind of a grasp of the general coverage, although we will be probably jumping around a little bit and answering some questions as we go in batches to kind of do our best to manage the time that we have available to us and the amount of material that we are covering. So we will be covering the psychological impact of lockdown and how to handle that impact. Sort of both what to do in lockdown. So retroactively, we know what to do next time, which helps with the stress and anxiety of the whole situation. And then what is useful for us now, this deep into lockdown, to better handle and unpack and all of that. We will talk on COVID fatigue, the impact of long-term social distancing and the disruption of life that we've all gone through over the past 6 months, how to be mentally healthy day to day, 6 months into the pandemic. We will cover what can go wrong, the psychological denial that many people are in about the seriousness of the pandemic. We'll also cover addiction, abuse, frustration, and how that outlets into people's lives. The escapist mindset, the way that sort of people go turn to shopping and other coping mechanisms instead of trying to confront and deal with the crisis head on, and sort of give some space so people can like understand and deal with that instead of trying to bury it. We'll cover how to be supportive of others. Us as a community and organization care a lot about helping other people, and we can be a resource for other people to help deal with what they're going through during this crisis, this ongoing crisis. Potential emergent situations of COVID-19, so suicidality, what to look for, how to intervene, some resources, contact tracing. We would like to acknowledge contact tracers. They have a very difficult job, and it's difficult and emotionally tough. They're investigators. They're doing case management. They're doing emotional support during a heartbreaking conversations with people. Compassion fatigue, and how that is affecting contact tracers and all of us. We'll also cover that Sam hosts a weekly meetup for contact tracers, so that and also chaplains, so that they have a community to turn to share stories and to build resilience and knowledge share. We'll try and batch questions a bit for each topic so we have better time management, but we can also interrupt with really good questions to allow a didactic and interactivity that makes this kind of video format and discussion forum of Ask an ECV Expert such a positive resource for everyone. All right, Sam, take it away. It's your floor.
Thanks so much, Gio. I appreciate that wonderful and warm introduction. And I also want to thank the other folks with NEXI and endcoronavirus.org that have helped make this Ask an Expert possible. I want to start off by acknowledging that there are continuing to be increasing numbers of increasing deaths, increasing positive test results, increasing positive families that have been negatively impacted by the virus. There have been, and I could quote many other statistics. And I just want to acknowledge that all of these statistics that we're hearing and that are increasing, statistics can be looked at as people with the tears wiped off. That as we listen to and we read the numbers, remember that each one of those numbers, however many hundreds, however many thousands, however many millions, represents a person. And with each person that has tested positive, or each person that has succumbed to COVID-19 or related issues, there's a host of friends and family members that are impacted by that person's death or that person's convalescence. So I want to first start off by acknowledging why it is that I'm here. I'm here because of those numbers, because of those people. And I want to be respectful of that. In thinking about how to start a presentation like this, I wanted to acknowledge what is going on, but I also wanted to say I'm sorry. I'm sorry that each one of you who are joining us here on this live presentation or are hearing this at some later date and time, I'm sorry that you're having to choose to watch this, even though you have a choice. I'm sorry that we're having to face this situation, this pandemic. In doing so, we're all in the same boat. We're dealing with this event together. Regardless of what city or county or state or country or continent we're on, we're dealing with this in our own ways, collectively being able to utilize healthful approaches. And as one part of a healthful approach, I'm honored to be asked to address the psychological aspects, the emotional aspects, the cognitive aspects, and even touch on some of the spiritual aspects. In looking
Thank
at,
you. Thank you for doing this. Exactly. Thanks for being here, and thanks for doing this.
It's my honor. I want to acknowledge that for most of us, we have never experienced a pandemic, especially one of this nature. We have, as a community, wherever, we have dealt with other kinds of medical emergencies, catastrophes, if you will. Everything from the flu to polio to TB. But those were in the past. And sometimes when things are in the past, they're out of our conscious awareness, and we forget some of the lessons learned from those events. So I want to encourage you to consider looking to the past, looking to the history on how folks coped with the flu, with polio, with typhoid, with Ebola. The CDC has a wonderful resource library online that can help you in your quest for understanding the historical perspectives of some of those dreaded medical illnesses. A pandemic, a medical issue of this magnitude can be overwhelmingly stressful, as we all know now. Not just fear of contracting it ourselves, but also the worry about our own health and the health of our family and our friends can definitely weigh on our hearts and even on our pocketbooks. Even the potentials for job loss, whether it be temporary or permanent, because things do change during a medical emergency, during a pandemic. customs shift. We may also even experience some changes in our sleeping habits, and our eating habits, and our interpersonal relationship styles, and our coping skills. And need I remind you about how important getting adequate sleep is? Restorative sleep, not fitful sleep, but restorative sleep, peaceful sleep that allows for the rapid eye movement to help us process what we have experienced during our day. Problems can also come in terms of concentration, focusing. When pre-morbidly, before the pandemic even began, we were inundated with lots and lots of information from lots of different sources. A bit of sensory overload. And to that extent, we were having some problems focusing, even pre-morbidly. And now that the pandemic is here and definitely among us, we have more information on top of the more information that we had before. So information overload is definitely present as well. As stress increases, we know from lots of anecdotal research, historical research, that as stress increases, so does the propensity for health concerns and also mental health concerns. So anticipating that with all of this increased stress, we will also be seeing increase in emotional coping problems and the manifestations of those, whether they be chronic mental illness or whether they be episodic that may turn to chronic. Increasing use of things outside of our bodies, such as tobacco, alcohol, other substances, other behaviors such as excessive shopping, even to the point of possibly cutting. It's going to be important for us to remember to take care of our own mental health first, because without our mental health being intact, it's going to be very difficult for us to care for others. It's very much like when we used to fly on airplanes and the flight attendant would direct us to put our mask on first before helping the person beside us. For folks who are working directly in the service provision, whether it be healthcare or other needed services, these folks are going to need us to be on point, to be sharp, and to be ready to address issues with all of our resources. And to do that, we have to take care of ourselves. It may sound selfish, but in the long run, it is actually for the health of our community. And that's what we're working for during this time anyway. Helping folks to realize that we're going to be reacting differently to stressful situations because we perceive them differently. People react to stressors given their background history. They react to different things due to their medical status, their age, whether they be young folks, toddlers, elementary school age, teenagers, young adults, or even older adults. Taking these age considerations into our considerations when we're interacting with folks. If you will, harken back to what we learned in Psych 101, and we probably just memorized it for the test, Erikson's developmental stages. And what are some of the pivotal points or pivotal themes that are associated with various ages? Let's also remember that folks who are the essential workers, both in healthcare, the food industry, and all of the other much needed service areas that keep our world moving, that they have their own issues and their own ways of coping that they bring to their life and thus to the rest of our lives as well. There are going to be some folks that are going to be pre-morbidly struggling with mental health issues, whether it be chronic or acute. It can be exacerbated by increased stress. And along with that, their coping mechanisms who are already stressed may become even more stressed. Folks who are living with various disabling conditions, whether it be some physical, cognitive, or developmental disability, they are also impacted by COVID-19 and the stressors related. People who are typically isolated from other folks for whatever reasons. Folks who may be natural introverts. Folks who may just not like being around other folks. Taking into account both cultural and ethnic and racial histories and backgrounds is going to impact how they process and deal with and react to and come out of the COVID-19 situation. Let's not forget about the homeless folks who are managing and living on minimal resources. And when we who are much more privileged are struggling with managing with less resources, let us remember that there are others that are struggling with less. Also, being respectful and mindful of folks who have various other differing religious or spiritual perspectives, that their views on life are colored by their spiritual history from their family or the spiritual pathway that they have chosen to go on their own. Those ways of living, those ways of understanding are going to be impacting how they manage this situation as well. So to say that the COVID-19 situation is complex is definitely an understatement. And then to even consider the psychological, emotional, social impacts as well. I hope that through some of my comments tonight, I hope I can give a bit more of a perspective. I'm not going to even try to say that we're going to touch all of the topics. I hope to at least bring to your conscious awareness some things to keep in mind, and hopefully some things that you can do to help yourself manage, help your family, your friends, and your immediate community manage as well. Because once again, COVID-19 knows no age, no race, no continent. So some generalities that I'll be drilling down into a little bit later. It's going to be important to know what to do if you are positive for COVID-19. It is important for you to take the high road and even to coin a phrase of the better part of wisdom would be to be a part of the solution, not a part of the problem. So self-isolate. Following the guidelines that are set. Acknowledging that, yes, this medical test has come back and it is reporting positive. And that your, if you will, civic duty, not just to yourself, not just to your family or friends, but to people in your community, to acknowledge the impact that you could have on them as well. So being civil, and we're going to be talking more about civility in a few moments as well. Realizing that there are support services that are set up and are continuing to be reinforced to help folks manage who are isolating or who are quarantining because they've come into contact with someone. It's important to realize that if you are feeling sick or ill with any of the corresponding symptoms, to seek appropriate help. Even if you don't have insurance, there are other ways of getting assistance that you need so that you can continue to be a part of the world and be a part of your family and friends' lives. To be able to take care of oneself, to be able to reduce the stress in one's life is going to be extremely helpful. But also reducing the stress in other people's lives is also going to be equally as important. So I want to spend just a moment on addressing the spread of rumors. Harkening back to many of the times when we were in primary school and we would be gossiping about one another, spreading stories that may be half-truths, and giggling at the outcomes. Now that we're adults, realizing that those rumors can also be really quite hurtful, and they can even be quite deadly now. Realizing that it's important to know the facts, and realizing that just as the CDC has coined the term an infodemic, where misinformation is also among us. Realizing that we can spread the disease by spreading misinformation, and we need to limit that just as we limit our sociability by limiting our physical contact with one another, not our social contact, our physical contact. By being able to realize that with the information, we need to be responsible with that just as we are with our behaviors. Being responsible with the information that we share with others, making sure that it's from a credible source and not some self-proclaimed expert. How do we do that? We can look into that as well. Realizing that some folks who may be in quarantine or isolation situations may be needing further entertainment to pass the time. Sometimes the more dramatic information that we find on social media or even on traditional media can be quite exhilarating. And we know from lots of research how exhilarating new and dramatic information can be. It's called adrenaline, and it can also be really quite addictive. Being able to know when to do things that are in the interest of our own self-preservation, but also in the preservation of those around us, in society, if you will, because we are of that human race. I want to stop and pause for just a moment to see if there are any thoughts or comments so far.
Yes, so we have a couple questions and thoughts that have been shared in the chat. One is, how do you think our emotional, mental response to this crisis compares to other types of crises we have all dealt with over the years? For example, terrorism, school shootings, natural disasters.
Okay. One of the things that I tend to do in my practice and how I interact with other folks is that I look to the past and what have we experienced in the past, and how can we take some of those coping mechanisms that were successful and how can we translate them into the current day, the current situation. They may not translate word for word, but the theme, the content, not necessarily the exact words, but the context is going to be important. So looking back on, let's say, the terrorist events of 9/11, how did our country, how did our world come to deal with that? How did we cope with that? I want to share with you a graph that actually you can download from the CDC. It's in a number of their publications. This is a diagram of a disaster timeline or disaster phases. And I'll try to get this up to the camera so you can see a little bit about that. So some of you may be familiar with this graphic. As we're functioning in life, there are some normal ups and downs. With some natural disasters, there may be some warning of the impending event, such as what we're experiencing now with the hurricanes or tropical storms that are brewing out in the waters. So there may be some warning of something coming. That's pre-disaster. And you can see that there's warning and then there's an actual threat. And the threat comes when we know that we are within that cone of impact. And we can do ourselves a favor and also our friends and family a favor by acknowledging when we have gone from the warning phase into the threat phase, where we need to take things more seriously. Then you'll see that there's an impact phase, and it brings about a change in what is on this axis, which is emotional highs and lows. You can see that there is a change in the emotionality. There's a dip, so things go down a bit. Now, with that, then the impact phase occurs, but like in any disaster or crisis situation, resources come together and they rally to help, to address, to mitigate the impact, and to help bring about recovery. And with that, then we enter the heroic phase, where people are pulling together. There may be a few little setbacks. Some things may take a little bit longer than we expected, but we're pulling together. And like many of us who are married, we went on a honeymoon. But unfortunately, that honeymoon didn't last forever. We had to come back from Hawaii, or we had to come back from Gatlinburg, wherever it is that we spent our honeymoon. And just as our natural honeymoon ended, so does the honeymoon for a disaster response. And therefore, now we're entering the disillusionment phase, where in this disillusionment phase, the reactions that we initially had may still be there. They may be worsening due to various characteristics, but they may also be diminishing because resources are moving on to different places. FEMA may have come in to assist us, and then we realize that the assistance was provided to other folks that we may not have met criteria. We may have missed deadlines, or some of the responding organizations may have moved on to the next tornado, the next hurricane, and sometimes the media moves on to the next story. And with those negative outcomes, those negative associated events to the event, you can actually see that the disillusionment phase has a much more negative impact than the issue that brought it about to begin with. In medicine, we call it the iatrogenic effect, where the treatment is actually worse than what it was designed to treat. So the disillusionment phase can have some false starts and some further decline. Now, these triggering events are things that may remind us of this initial traumatic event, or these triggering events may remind us of some of the negative impacts that are secondary to the primary impact. Now, what is interesting is that this disillusionment phase is many times made up of folks who are trying to help, organizations, individuals. Again, trying to help, but because of red tape, because of lots of complicating factors, it actually brings about a decrease in the emotionality. It brings about low emotional responses. Now, what's interesting is this point right down here where there is a pronounced turn and the trajectory changes. In looking at this point right here, it's interesting to consider what might affect or bring about this change right here. So some of the characteristics of this point right here come from society, from communities, from individuals who, during some sort of traumatic event, realizing that they may not have done anything to bring this about to their community, to their family, to their person. They may not have done anything to bring this about in their life, but it is theirs to deal with. So we're talking about ownership of the response. Likewise, I'll share a story when I was volunteering with the American Red Cross and their disaster mental health function, riding on the ERV, the emergency response vehicle that would take food out or supplies out to folks that were impacted by various events. And on this one particular day, some of the other volunteers had gotten up at like 5 o'clock in the morning to make sandwiches for the lunchtime. And when we took those out to disperse them, folks that were impacted by the tornado would come and approach the ERV, and the Red Cross volunteers would start to hand out the sandwiches. And we would hear many times some of the survivors saying, "So what's for lunch today?" And the Red Cross volunteers would say, "Oh, it's PB&J, peanut butter and jelly." And on this one particular day, the tornado survivors turned and said, "PB&Js again? I don't think so." And they turned around and walked away without getting their complimentary PB&J. Now, for the Red Cross volunteers, many of those, they were devastated. Oh my gosh, they don't want our help. We were up at 5 in the morning making these. They don't want our PB&Js. While at the same time, I was in the back doing a happy dance. The reason for me doing a happy dance is that in order for survivors to reject help, they must have some other alternatives. They may have some, if you will, Dinty Moore beef stew somewhere else that they can eat instead of PB&Js. So I want to impress upon you that for survivors of whatever, survivors, when they are in the midst of a situation, many times they're victims. Victims don't have choices. If victims had choices, they would surely choose not to be a victim. Duh. But when victims see in their own mind, in their own head, in their own heart, in their own soul, that they have a choice, they don't have to take the PB&J. They have other options. And it's not just with food. But when folks who are victims of anything see that they have a choice, they move out of victim status and they're now survivors. And when survivors get a stronger foothold or even a stronger cognitive hold on the situation, on their reactions, on how to go about addressing the plight that they're having. They're embracing their survivor status. And then when those survivors are able to get back, if you will, in the saddle and even become productive again in whatever they choose to do, whether it be being a family member, being a productive member of a company or organization, or a productive member of society. When folks are able to learn from some sort of catastrophic event and to be able to function at a higher level, they're no longer survivors. They're thrivers. And with that, when folks can turn this point right here and start the upward trajectory, notice that there's going to be some setbacks. These setbacks may be some traumatic memories of what had happened previously. And those traumatic memories may be sights and sounds and smells and tastes and touches and time, and even locations. Can bring about, if you will, flashbacks to other periods that cause a setback temporarily. Now, as time moves on, it's not just time, but it's what people are doing with this time, how they're processing the event that happened and the resultant reactions to the event by not just themselves, but other folks. That helps to determine if they are able to function at a pre-morbid level of functioning, or are they able to function at a higher level? So are they able to achieve post-trauma growth, functioning at a higher level than they were pre-morbidly? Now, relatedly, there are some folks who will only be able to get back to where they were previously. Also, we have to also acknowledge that there are some folks that are not going to be able to have post-trauma growth. They may not be able to get back to their pre-morbid level of functioning. They may actually not be able to get back to any of those levels, and they will be functioning at a lower level, and that's post-trauma regression. In medical terms, this is someone who has gone through rehab and they have been able to regain their functionability and even function at a higher level. There are some folks that are able to heal and they are back to where they were. There are some folks that aren't able to heal, but there are complications psychologically. Realizing that this is a graphic representation of natural disasters, natural kinds of events that can happen, and our reactions to them, and how we can conceptualize how we're going to be moving through this. So I dare say that we may be somewhere in this area right now, because the reactions that are occurring to COVID-19, the secondary reactions, are actually more pronounced, worse, if you will, than the original insult, which is the virus itself, which is bad enough. And I don't want to diminish the impact of the virus here. But the secondary responses to the virus is what is leading to a decrease in emotionality. In this decrease in emotionality, functionability is being impacted. So what I would want to suggest is that how do we get to this point right here? If we use the two examples that I just gave, one, ownership, where the victims, if you will, take ownership of the situation, regardless of whether they deserved it or not. That's not the question. It is theirs to deal with. And yes, life is unfair. And also, when people are aware, when they are able to not just cognitively realize, but psychologically, emotionally, and in their soul realize that they are not victims, that they do have a choice. And our health department, CDC, World Health Organization, is giving people choices. They're letting folks know how they can take ownership and how they can not just be a victim, but they can be a survivor. And ultimately, hopefully, a thriver due to post-trauma growth. Now, we also have to realize, just as in the first example, that there are going to be some folks that will be able to just simply get back to their pre-morbid level of functioning. But there are also going to be some folks who are not going to be able to get back to their pre-morbid level of functioning. There's going to be post-trauma regression. In emergency management terms, the folks that are having post-trauma regression, those may be seen as fatalities. Now, I'm not talking about death, but death could include those. But folks who are not going to be able to return to their functionability, both emotionally, psychologically, cognitively, after having experienced the event and the responses to the originating event. Some thoughts or comments about that?
Yes. So I think that we at ECV might be categorized as those who have taken ownership. We're taking responsibility to try and push for change instead of sitting around and waiting for the government to do what needs to be done. We've pushed at a community level, we've pushed at an information level, we've pushed at the government level. We've tried to share knowledge that allows people to take ownership themselves completely, making our own masks. And so what can we do to amplify the survivors into thrivers as an organization internally for ourselves? I know that I'm personally in the disillusionment phase of this and have been trying to hold on so that I can help the community that I'm a part of here, but it's very hard to just stay with it and not kind of lose the energy to put forward effort in this project, because I've felt like we've hit so many barriers, and I'm sure that that's not an exclusive experience myself. But for us, how do we get to that reconstruction phase? How do we build out of this? How do we restore our vibrance and emotional life so that we can get out there and do good and save lives?
That's admirable, very admirable. And it's admirable for people to come together to populate an organization such as InCoronavirus.org, NEXI. But mind you that just because an organization takes ownership doesn't mean that the general population is going to. So realizing that this is much more complex on a national level, but also even on a global level, where people as a culture, as a country, when they're able to see themselves not necessarily as a victim, but as a survivor because they have options. But also that while they did nothing to bring this about, it is theirs to deal with. So relating this emergency management concept to this situation The folks that are simply wishing it to go away, they haven't owned it yet. So we're not there. We're not there yet. Now, there are some things that we'll be talking about, some coping skills that I'll go into more detail that can assist with that. But at the same time, there are both positive and negative coping skills. And when folks engage in some of the negative coping skills, that's going to prolong the disillusionment phase. Now, we see this in individual therapy, in group therapy, marriage and family therapy. So there's truth here that is being able to be translated, not just one-on-one in traditional psychotherapy, but in dealing with a pandemic. So until we get a majority of the folks owning the situation and being able to accept ownership of that and not blaming others, then we've got a ways to go.
Can you think of, I guess, what might be characterized as a shortcut to that ownership, like sort of I think it's a Ben Franklin idea about when you move into a new neighborhood, ask your neighbor to do something for you so that he can ask you to do something for him so you can build reciprocity. But sort of the idea of a small ask can get the foot in the door so that something bigger and better can be built. Do you have any ideas of how we might be able to facilitate that as perhaps with a national conversation or a conversation that can spread into a national conversation? Do you have any thoughts on facilitating that transformation?
And I think that we're starting to see evidence of that through media accounts, through social media accounts, of where folks are starting to pull together. And I think that we're now getting to that turning point where folks are starting to. We're just not there yet. The time frame for responding to and mitigating the impact of a tornado or a hurricane, we're used to that, and it's fairly short-lived compared to a pandemic. I think we're just trying to rush things. It's taking some time to get there. It's protracted because of the nature of the initiating event, a pandemic, as opposed to a tornado or a hurricane or even a wildfire.
All right. Playing off of the last or the previous before this question, kind of. So we talked about survivors. How does one address the guilt that might come along with getting COVID and then spreading it to a family member or such, even when you did everything you could and it wasn't enough? I'm sure that people feel like I'm the one who caused this when they were merely sort of the agent of something instead of the agent themselves. How can one deal with that? And more society-wide, I think that this is part of the denial, is not wanting to address the potential of the guilt. So I think this is an important realm to delve into.
Well, to address the survivor guilt issues, many times with survivor guilt, some of the unspoken self-talk messages are, why was I spared? What makes me better than other folks to have not succumb to whatever the situation is. And if we are able to step out of and I'll dare say kind of that narcissistic viewpoint where it's all on me, but looking at survivor guilt in terms of there are some things that I know and there are some things that I don't know. And that's on a time continuum. And we may know some things at time 0 when a certain event occurs, but at time 0 plus 3, we have new information. And many times that survivor guilt is based upon time 0 information and not time plus 3. That if we were at time plus 3, we would surely make different kinds of decisions. So the concept of we can't necessarily be held responsible for information that we did not know or we did not have access to can come into play. So realizing that we would make very different kinds of decisions if we had different information, different data to make those decisions upon. Now, that can also be related to how we come to live our life. And let me get to some other visual aids here. And yes, I've kind of gone high tech here. If we look at the ABCs of an event, we have an activating event and we have the culminating outcome, where everyone experiences the same activating event, but we have different outcomes. And how is it that we get from A to C? And what's in the middle here? Any ideas?
Response is the answer we have in the chat.
Okay. The response is over here, but how do we get from an activating event to the culminating outcome, which is our response to this event? What is this?
I think we've got B for behavior popping up in the chat here.
How about beliefs?
That's a good one.
Our beliefs about the event will determine the outcome of this event. Just as in this graphic. Now, again, everyone will have experienced this. What we believe about this and our beliefs that were existing prior to this event will determine the outcome. Here is the formula for what's going on in our nation. For the folks who are saying that masks are bad, social distancing is bad, they have beliefs that predate the event, but their beliefs that predate the event plus their beliefs about the event drives the outcome. Let that sink in for just a moment. So the question becomes, how do we go about having a discussion about how we can augment beliefs to bring about a more positive outcome, not just for individuals, not just for a certain group, but for all? And that brings us back to coping mechanisms, defense mechanisms. Let's talk just a bit about, before we get into the depths of coping mechanisms, what are some of the various categories of reactions that folks can have to any sort of event, a traumatizing event, a crisis, if you will? The reactions that folks have can be positive, can be negative, can be helpful, can be hurtful. If they are deemed to be a crisis reaction, now please note that there are some situations where a crisis will occur. I'm getting ready to make another graphic quickly here to illustrate a point. If we have a crisis event that everyone experiences, we can divide that crisis reaction into thirds. The first third, these folks, because they have a robust cadre of coping mechanisms, of resiliency qualities, that these folks, because of their positive coping mechanisms and the absence of negative coping mechanisms, such as negative people, negative kinds of behaviors that are not healthy, that sort of thing, these folks will experience this traumatic event as a speed bump in life that causes a bit of a slowdown. There may be a little bit of a bobblehead effect, but they are able to continue on their journey. Now, for this same population that experienced the same event, there is the second third. This second third, these folks don't have as robust of coping mechanisms as the first third. They actually have the presence of some negative coping skills. They may have some not so healthy coping mechanisms, habits. They may have some presence of some negative people in their life that are not helpful. And for this second third, this traumatic event, it's not a speed bump in life. It's a pothole that has caused them to bend the rim of their tire, of their wheel. And they have to pull over to the side of the road. They have to call AAA. They have to get the lug nuts off. They have to go to Walmart, get a new tire, come back, put it back on, and then they're able to get back on their journey. Again, same traumatic event. Then we have the third third. This third third of the population that, again, experienced the same event, because of this third third, they have minimal positive coping mechanisms. They may have the presence of lots of negative coping skills. They may have lots of negative people in their life. And for this third, it's not a speed bump in life. It's not a pothole. For this third, it's a sinkhole that has opened up and it has swallowed them up. And sorry, but AAA isn't going to be able to be of help. They're going to need to get heavy rescue and lots of extra equipment out there, and they may need to be hospitalized and rehab, and they may or may not be able to get back to their premorbid level of functioning. They may actually have post-trauma regression. And it may be that the part of this third may actually have to go on disability, whether that be physical or cognitive, emotional. This third many times are seen as psychological casualties. In the truest triage sense, Group 2 and Group 3 are casualties because they required some assistance. Group 3 are the ones that are the more severe casualties. Now, casualties, I mean inability to return to functioning. Doesn't always mean death, but it can, because it's this third that may have a higher possibility for suicide. Now, here's some good news and some bad news. Some good news is that some folks have done some research on this, and this third is not 33 1/3%. Thank goodness. Research has shown that this percentage goes anywhere from 3% of a population up to maybe 11 to 13%. With a meta-analysis, an average of about 8% are going to be this third. So what's the theme of this 1/3 rule? Well, that there are going to be different folks that are going to be impacted by this same event in different ways. Some folks, they're going to be able to deal with it and continue on with life. There are some folks that are going to need some assistance. And there are going to be some folks who are going to need lots of assistance and may not actually be able to deal with it in a productive way. That sounds very similar to post-trauma growth or post-trauma regression, doesn't it? It does. So in looking at this from a pandemic standpoint, the folks that I think we are hearing the most from are these folks and or these folks. When in actuality, groups 2 and 3 are at maximum 25% of a population. So the vast majority are doing okay. It's just that about 25% are needing some assistance and are having some difficulty. Now, might we need to focus on these as opposed to these? Because these folks, their coping skills are working for them. That's working. So why would we need to fix something that's not broken? So here are the folks that we need to focus our attention on. Some thoughts or comments to that concept?
So we have a question asking is this a standard deviation phenomena? The range of impact here.
Okay, I'm sorry, what was that?
We have a question in the chat asking, is this a standard deviation phenomena? The sort of 1, 2, 3 response sections.
Originally, that concept was theoretical. Since then, other folks have done research on that, and that's where we have been able to say that the majority of the population is going to be here, under the bell curve. There are going to be some folks on both sides of the bell curve here that are going to be the tail end, the bottom tail end, as opposed to the top tail end, okay? So again, this, groups 2 and 3 are basically 25%, where this is 75%. The majority of the folks are going to be here.
All right. Another question we have that may play off of some of what we've been discussing so far is how do we get to recovery in the midst of this crisis?
Okay. Wow, if I had a real clear-cut answer for that, I wouldn't be here. But I am going to be sharing with you some of the ways that we can seed the ground for moving in that direction. So we need to realize that there are going to be differing groups of folks in any given population, okay? And while they may be functioning in this group during event number 1, when another event happens, they may be over here because of life situation changes or whichever. It may be that folks that are here are able to achieve post-trauma growth and they're able to move here or maybe even here. So this is also dynamic over time, from event to event to event. Now within the event, this can also be dynamic. Folks can realize, have epiphanies, and can move into the first third from either of those. So one of the ways that we can help facilitate the highest potential for returning to a premorbid level of functioning and or an epiphany to where they're able to function at a higher level, post-trauma growth, the first is by support, providing support and encouragement. Now, one of the ways of providing support and encouragement is through some psychoeducation. So one of the initial ways of providing psychoeducation during an event, and even after an event, is talking about reactions. In order for an event to be traumatic or bring about a crisis, there are 3 criteria that need to be present. One of 3. One, if there is psychological homeostasis that's disrupted. In other words, does it get them off balance? The second is if their usual coping mechanisms fail them. Whatever it is that they use to cope with an event, if those coping mechanisms fail them, then they could be in a crisis situation. The third criteria is there evidence of impaired functionability? You can think of it in terms of job description. Is a person able to perform their job description that they have at work and at home? Are they able to do the tasks that they would typically do? So if any of those criteria are met, then we know that they are in a crisis situation. So if we look at people's responses to the pandemic, and even their responses to the civil unrest, are there any of those 3 criteria that have been met? If not, then they're probably not having a crisis situation in their life. So if we assume that at least one of those criteria are met, and a crisis event is occurring, what kinds of reactions may people be experiencing? And they can be lumped into 5 categories of reactions. The first category is physical reactions. You can think of this in terms of medical reactions, signs and symptoms, if you will. Such things as like chills, nausea, vomiting, gastrointestinal distress, fatigue, hyperventilation, vague muscle pains, aches and pains, that sort of thing. Maybe even some elevated blood pressure, maybe some dizziness occasionally, those sorts of things. Now, those are some normal, kind of traditional or expected, common reactions that are physical in nature to a crisis event. And those don't need to be treated necessarily. They need to be acknowledged, and they need to be supported. And if they get worse, then they need to be treated. But here's another list of physical reactions that are pathological in nature, that if they occur, they definitely need to be referred to a higher level of care, which would typically be a healthcare professional. Such things as fainting, loss of consciousness, weakness, numbness, chest pain, extremely rapid heartbeat that continues for some time, maybe even irregular heart rhythms, unusual headaches, bleeding, difficulty breathing, those sorts of things. Those are some physical reactions that would need to be addressed by a medical professional. Now, if we move to the second category of reactions, which are cognitive in nature. Cognitive, I'm talking about thinking reactions, how we think. So some normal cognitive reactions might include dreams that are upsetting, maybe uncertainty, hypervigilance, being jumpy, kind of on edge, maybe even some suspiciousness, maybe even some intrusive images of things that they've seen before that their memory is cued. Maybe even blaming other folks. An inability to concentrate as one once did. Maybe even memory problems, maybe some slight disorientation, but nothing chronic. Changes in awareness of surroundings, problems focusing or attending. Those are some, again, some typical, some average, some expected reactions that don't necessarily need to be treated, but if they get worse or continue, would need to be treated. But definitely the ones that I'll be talking about next are the abnormal cognitive or thinking reactions that if they do occur, they would definitely need to be referred to a higher level of care. That could be to a medical professional or to a mental health care professional. Such things as disabling guilt, paranoid ideas, consistent problem solving or problems attending or focusing, maybe even hallucinations that could be visual in nature, auditory in nature, kinesthetic in nature, such as touch, or even olfactory in nature. So any sort of hallucinations, or even delusions. Delusions are thoughts that are not based in reality. Inability to understand consequences of behaviors. Hopelessness or helplessness, again, from a cognitive perspective. Persistent confusion, difficulty making decisions, those sorts of things would need to be referred to a higher level of care. That's the cognitive responses to crisis. We now move into the behavioral responses, behaviors, the way we act, our outward manifestations. So some of the normal, expected, common reactions from a behavioral perspective could be withdrawal. Withdrawal from social interactions, from social media, kind of a pulling back. Possibly some erratic movements, changes in social activity, changes in speech, rate, or pattern, changes in appetite. Sometimes when some folks are dealing with a crisis situation, they want to eat everything in the grocery store and the supply trucks in the back. At the same time, other folks, they may not be able to eat anything for the next 3 days. So speech can be impacted, appetite can be impacted, and sleep can also be impacted. So some people during a crisis event, they may need to take a nap, while other folks, they may be wide awake for the next 2 or 3 days. Their communication style may change as well. If they're gregarious and outgoing in the life of the party, they may become quiet and withdrawn. Or if they're usually quiet and withdrawn, they may become outwardly gregarious. There may also be some changes in how they relate to one another, interpersonal relationship styles, and even the way that they relate to their intimate partners. Some of the abnormal behavioral responses that, if they occur, would need to be referred to a higher level of care include such things as increased risk-taking that's unusual for them. Such things as diminished personal hygiene, not taking care of one's hygiene, violence toward self, toward others, toward animals, toward inanimate objects, walls, cars, things like that. Or even immobility, not being able to move. There may be some evidence of family discord, arguing, that sort of thing. Those sorts of things. Moving on to a fourth category of reactions has to do with emotional reactions. Everything from anger, guilt, grief, panic, anxiety, frustration, you name it. Those are some typical reactions that, if they occur, they're common, they're to be expected. But if they become continual or increase in severity, would need to be referred to a higher level of care. Some of the emotional reactions that would need to be referred, definitely, include such things as pathological grief, grief that immobilizes a person to where they're not able to function at home or at work. There may be some phobic avoidance responses where they become so frightened that they can't go outside. There may also be some return of infantile emotions. They may respond like they did when they were much, much younger, as an infant or toddler. There may be some immobilizing depression. There may be also some fear that would be a normal response that may become immobilizing, that would need to be referred to a higher level of care. There may also be anxiety that can be problematic as well and would need to be referred. The final and the fifth category has to do with spiritual reactions. Now with this, I'm not talking about religious reactions, but that is a subcategory. I'm talking about, on a larger scale, spiritual reactions. So some of the normal, expected, common spiritual reactions could include such things as being angry at God, maybe experiencing a crisis of faith, doubting God's existence or some higher power, loss of sense of purpose, maybe a loss in belief in a just world. And when some of these spiritual reactions become pathological, it would need to be referred to a higher level, and that would usually be spiritual care professionals, would be such things as withdrawal from their spiritual community. If they believe that their higher power has abandoned them. If they are having religious hallucinations or even delusions, again, thoughts that are not based in reality. If they also cease to participate in faith practices. If the going to church and going to the altar on one's knees and praying fervently, if that no longer works, if that no longer brings about comfort, then there's a crisis of faith. Or if saying the rosary no longer holds meaning, or putting one's mat down facing east and praying 7 times a day, if that no longer holds meaning, or if putting the chicken feed in a tin can and throwing it on the ground with a diagram on the ground, if that no longer holds meaning, then that's a crisis of faith and would need to be referred to a higher level of care, which is typically a spiritual care professional. So it's going to be important for folks to realize what are normal and abnormal responses to crisis. And some folks may actually confuse those. They may actually believe that they're having an abnormal response to crisis when it's actually quite normal. And some of those normal reactions, they can definitely not feel good. They can be disconcerting. But it doesn't mean that it's pathological. Some thoughts or comments?
Yes, there's several things I'd like to cover. One that I think might be kind of an interesting case study is one I wrote in the chat, which is, I know some friends and family who have had nightmares and have been specifically, I described as traumatized by the idea of the disease, and have said things along the lines of, I went out of the house to a friend's house for a few hours. I'm going to die of COVID. I'm a horrible person. I deserve to die for kind of going out of the house and visiting friends and sort of not being in full isolation. And, you know, this is the kind of like the extreme end of isolation, and the fear response that drives that isolation can take people places where it's extremely difficult to cope with the sort of necessity or choice of exposure. And so there's kind of a dark side, I would say, to kind of the fervent level of dedication to safety that can be sometimes necessary to actually reliably take the steps that are needed to stay safe and avoid infection. And so it's not just be safer. We need to find ways of being safer in mentally healthy ways.
Yes. And definitely acknowledging that I'm definitely not a physician, I'm not a virologist, but knowing that the behaviors that we can embrace that will help limit our exposure to the virus needs to be embraced. Now, that doesn't mean that we go into shelter in place and duct tape and plastic wrap our windows and doors. Absolutely not. That would be highly counterproductive and deadly. But how can we go about using those suggestions, those parameters, to help guide our behavior? Being able to apply those recommendations and to stick to them as much as we can is going to be important. But by no chance, by no means would we want folks to stay at home if they're having a heart attack. No. The chances of you dying by a heart attack if you don't get medical care is much higher than you would by traveling to an ER to get treated for that heart attack versus possible exposure to COVID. It's looking at perspectives and looking at what's the most important thing right now. Now, realizing that for folks to be able to isolate or quarantine, they're going to need to have some support services to be able to do that, such as they're going to need to limit their exposure to other people, such as not going to the grocery store, maybe other folks can rally together and can go to the grocery store and purchase food for them, and they can leave it on their doorstep. These are ways that we can manifest those strong suggestions to help limit the exposure to the virus without having an absolutist kind of pathological mindset to it.
Yeah, that's one of that's one of the things that happened in my community early, so like late March or early April, was there was a couple families who went through to every door and left a little note card saying, "Hey, we'll do shopping for you." Because it was kind of at the time, it was like older people are definitely at higher risk than younger people, and kids especially. So these families with young kids kind of like started a little local community where the kids would do the shopping and deliveries, which was hoped would reduce the risk of exposure. And I thought that was kind of neat. I wasn't sure if we had like enough information to say, yes, this would really work, but the idea that people would come together to commit themselves to do something like that, I thought was really beautiful. And kind of on the other end of the psychological impact, one of the things that I've found especially frustrating and putting me the furthest into the disillusionment is one of the ways that makes taking care during this crisis sane, at least in my opinion, is that it should be a population-wide effort. It should be, let's eradicate the disease. And if we're trying to eradicate the disease, none of us have to be perfect. We just have to be better than one. So if we get the disease spread rate, the R effective below 1, the disease will go extinct. And so we don't have to be perfect. If we are good enough to get below 1, then the disease goes away and we're done with it. The more we get below 1, the faster that happens. But once we get below 1, it happens eventually. And the point of frustration has been that it seems we've divided into two camps of people who don't want to get COVID, period, and are taking such an extreme position of their own personal safety that it's psychologically traumatizing. And then the rest of society is almost blasé about it and is kind of taken a stance of, I will not do anything to mitigate the risk of the disease for myself or for society. And that has been really the place where it has cut the deepest for me personally, because I see it as, hey, I'm going to be 95% good and 5% bad, and I can do that for months on end, and my personal risk will be relatively low, but then the risk that I'm presenting myself to society will be low enough that if everybody else replicated this, which I know I can handle for a long time and everybody else could handle for long enough to get to 0 from getting below 1 by getting below 1. And we've never had kind of the reckoning to sort that out in the discussion sphere. And this has been quite rough. Go ahead, Sam.
Your point is well taken. And I dare say that everyone, relatively everyone, has had access to that information. And if information alone would bring about a change in behavior, we wouldn't have a problem. Duh. Because there has been an incredible educational outpouring of information, of knowledge. Even though it's a novel coronavirus, we have gone about the educational process to update people of new information, new data, new knowledge that we have, that if we'd have had it 2 months ago, would we have made different decisions? Yeah. So being able to look at, so is it information that we need to focus on? I dare say no, because that's out there. There's plenty of information. There's plenty of access to information, whether it be through digital means, through print means, whatever, through radio stations, whatever. There's plenty of information. So what is it that is causing an interruption into the outcome? It's people's beliefs. People's beliefs before the event even took place, and people's beliefs about the event in and of itself. Their beliefs are driving their response. So to be kind of blunt, we need to continue updating information, but we need to get off the information bandwagon and start looking at how can we go about dealing with people's beliefs in a more productive, pro-societal way. Because the information's out there. And apparently that's not working for some folks, for about 25% of the population, I would imagine. So how do we look at beliefs and how our beliefs manifest? For many folks, beliefs become manifest in how we look at life, at the things that we hold dear, the worldviews that we have in life. So let's take a look at worldviews. Worldviews are concepts that we learn in life, but we don't learn them in a schoolroom, sitting in a chair, listening to a teacher teach us these worldviews. They're many times learned socially. They're learned many times by interacting with family, is the primary way that we learn them. Then later on in life, we learn these worldviews by interacting with friends, with folks in school, with folks at work, with folks in our spiritual communities. So I would ask that you take a look at what are some of your worldviews that you hold dear that help guide how you look at life. Take just a moment and think about that. If you're having a little bit of a difficulty comprehending what I'm saying, that's to be expected too. Kind of a trick question. Worldviews are typically just under conscious awareness. So it's hard to pinpoint what those are. But if I were to articulate some of those worldviews, chances are you go, oh yeah, and then some would start to percolate out. How about the worldview of the world is a just and fair place? Some of us hold that idea, but some of us have held that idea and have gotten that busted many years ago. But how many of us hold the worldview that parents shouldn't have to bury their children? That's a worldview that many of us still hold. And because we hold that worldview, that's why children's deaths get so under our skin. It disrupts us so significantly. So I encourage you to think about what worldviews might you have had violated during COVID-19. And feel free to put those in the chat section if you'd like. When we experience a traumatic event, Many times, the traumatic event in and of itself may challenge our worldviews, but more than likely, what will happen is that during the disillusionment phase, our worldviews will get violated here and will cause a much more significant impact than the original initiating event. So worldview violation will cause this to go even deeper. So if we can take perspective of the folks that are anti-mask, that are anti-physical distancing, what are their worldviews that have been violated, that have brought about this kind of reaction? Because it's those worldviews, those beliefs that are driving their response to the event. This will tie in a little bit later on to our discussion of civility and how being able to take perspective is so very important. We've been going for about an hour and a half. Do you all want to take a short break?
Yes, I think intermission right now might be a really good idea. So kind of the way that I'm thinking we'll do this is have a 10-minute section or so. So say like it's 8:07, we'll go to like maybe 8:20. So there's a nice clean time that we all know. And during that time, we can probably just have an open discussion and it'll be cut out of the final recording. And if anyone wants to step away for a bit, there will be time to do so. And then we'll return and we'll focus more on Q&A and also on covering some sort of specific, more compressed topics that we can chunk a bit. And we'll kind of move between the two where we'll do discussion and Q&A, and then we'll kind of do like a sort of more focused topic for a bit, and that'll be kind of how we do and such. So if anyone wants to come off of mute and ask some live questions, then Sam, you have some free time to get up and walk around and do whatever you need to do. And we'll get to that question asking afterwards, but we can kind of hang out for a few minutes while the intermission is running. So I have a 10-minute intermission.
Okay, so in my planning, some of the topics that I have left to cover, doing a little bit deeper dive into coping strategies, also looking at suicidality, and then also addressing civility, and also providing some coping resources, and even looking at the concept of fatigue, COVID fatigue, if you will. So those are some of the leftover topics that we can address afterward as well. To address some other things, particularly around the emotionality issue. Typically, as we're interacting with our world, we are much more cognitive than we are emotional during a typical day. During our normal lives, it basically averages out to where we're more cognitive than we are emotive. However, when we have some sort of traumatizing event to occur, here's the event. What happens is that the emotional part explodes into multidimensional parameters, while the cognitive component actually diminishes. So many times what we in disaster mental health management, if you will, our task is to try to bring cognition to chaos, to try to get us back to this type of functioning from this state over here. Now, we do that through psychoeducation, through various sorts of cognitive tasks that acknowledges the emotionality and provides some coping skills, how to cope with this enormous emotionality, to try to bring it back to this proportional functioning. Now, it's my thought that we have considerable amount of education out there to address the emotionality. In the pandemic, we may be actually dealing with people's beliefs that are complicating this. So we may actually need to address not just the cognitive, not just the emotional, but the combination of those two, which is beliefs. One of the topics that seems to have united folks is how are we going to be protecting our children of whatever age? And going on off of what Ed Hatcher was saying, looking at developmental stages and where is the child developmentally? What are they able to understand? What are they able to conceptualize? We know that from lots of experience and research that for the younger children, that interacting with some sort of mental health professional is not the way to go. But it's having those mental health professionals interact with the adults in their life to help coach them, to help provide them with some extra coping skills, mechanisms, tricks, if you will, to be able to work with their own children, whether they be parents or whether they be teachers, because very young children need to rely on folks that they feel comfortable with, that are common to them. And that would be a teacher or a parent. If I were to go into an elementary school, I'm an unknown entity. I'm not known. They don't know me. So they may have some difficulty trusting me or approaching because they don't know me. They have never interacted with me. So the mechanisms of interaction typically go with the younger folks, helping to fortify the adults in their life. And as the child's age increases, so does the level of interaction with other professionals. So that as the child's age increases, the interaction with the teacher typically decreases, because we all remember how our high school teachers, they really didn't know anything, but when we had a guest speaker come in, wow, they were really neat. They were someone new. So as a child's age increases, so does the receptivity of someone new. So professionals, mental health consultants, counselors have a higher likelihood of being able to interact more successfully with the older kids. Ed, do you have any thoughts or comments about that?
Yeah, I think that that's true. The other thing is ability, particularly since we're talking emotive versus cognitive, limitations, both expression. That's why, with younger children, we would tend to use play therapy techniques, um, you know, uh, as you say, art therapy, sandbox, and different kinds of things because they don't have the vocabulary to express their emotions. And so usually they're going to reenact that. And so by saying it's okay to reenact that and allowing them to play, it's going to give you a lot of insight to where they are in their environment. So that would be one of the other things to keep in line, because it's not just cognitive conceptualizing, but the ability to cognitive and emotionally express, be verbal, children or not.
Mhm. And kids are going to be expressing how they're understanding the situation through symbolic play as well. So that's why it's so very important. And I think the general rule of thumb is somewhere around 12 years of age and younger. Typically, we suggest that the main therapeutic interaction be more play oriented as opposed to verbal interaction.
Can I throw a question at you, Sam?
Mm-hmm.
Because it kind of comes to the cognitive element of this. You said something earlier in the presentation, which I thought was very good, about data points. Day 0 data point, I've got a different set of data than I do +3 data point in the whole new set. Well, now we're at day 60, and these data points have been moving all over the place. And so what I'm thinking about is, does that kind of lessen the credibility of the data and increase the affective because of the lack of trust in the data, since it is so fluid?
I think it can be. And I think that this is where another profession is going to be so very important in interacting with the public, and that is with public information officers. Public information officers have one foot in their agency, whether that be emergency management, government, whatever, and they have one foot in civilian life. And they are the ones who are uniquely qualified to translate this into this. So when there's discrepancy in data coming out of here, the commonality is that public information officer being able to connect the dots, being able to make sense, if you will, of this for this population. A manifestation of that was actually when I was doing a residency for my PhD, excuse me, at Erlanger Medical Center here in Chattanooga, our Level 1 Trauma Center. And what I did is that I focused primarily on information giving, not providing traditional therapy, but looking at the impact and effect that information had on patients and staff. One of the interesting outcomes that I didn't anticipate was I was able to basically avert around 3 to 4 fairly major lawsuits for the hospital because I translated the stuff from the hospital, the medical speak, if you will, into the speak of the patient or the patient family. And where they were on the same page, but they didn't realize they were on the same page. And being able to take the information from the hospital, from the doctors, the medical perspective, and being able to have a foot in both worlds and being able to translate that information into some usable information here can bring about not just behavior changes, but actual healing, both physical and emotional, psychological. We know that by being able to provide information about disease process can be strengthening, can be helpful for a number of patients, so that they know, they now know the dragon, they know the name of the dragon, instead of not knowing what's going on. They know what to expect. And I also strategically wanted to explain this graphic, because by explaining and just showing you this graphic, how many of you had some decrease in your anxiety? I was able to bring cognition to chaos by being able to show we're right in here somewhere. Here's where we've got to go. Here's what we have to look forward to. Here's where we've been. So providing information to adults, to teenagers, to children in a way that they can digest, that they can understand, is going to be paramount. We also have to take into account people's beliefs. What are their beliefs, and how can we interact with those beliefs to be able to bring cognition to chaos, so that they can cope in a more productive manner, and hopefully in a globally more healthful, productive manner.
Essentially, how can we find ways for the beliefs to meet the information in productive ways? Which is, I think, part of what ECV has been trying to do as an organization. So it's good to hear that we're kind of on the right track, so to speak. We kind of laid out a few of the topics to move to. So we've kind of done a bit on coping strategies, I think. Did you want to talk about suicide for a bit?
Yeah, and there's more to coping, by the way. It's a lot more complex.
I think it'll emerge perhaps from some of the suicide, and we can do multiple at once.
So just to give a quick perspective, this graph comes from the Centers for Disease Control, and it's the leading causes of death by age group in the United States. And the most recent data that they have is from 2018. And I'll show you that graph.
It's a bit hard to read.
So I'll narrate, just so you can know where the colors are. The blue is unintended death. The red is homicide. And this first column is less than 1 year. The second column is 1 to 4 years. The next one is 5 to 9, 10 to 14, 15 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64, and 65 plus.
Sam, is it helpful if I share this on a screen while you talk over it?
You can do that. Notice that suicide is in the green. So for ages 18 to 34, suicide is the second leading cause of death in the United States. For the ages of 35 to 44, it's the fourth leading cause of death, even all the way up to age 54. Then for 55 to 64, it drops down to the 8th leading cause of death because of various medical conditions that are associated with aging. Now, mind you, this is on a typical day or on a good day. So now if we superimpose on top of this COVID-19, not just the virus itself, but the secondary after effects of social isolation, social distancing. The other kinds of secondary impacts of not being able to have the same sort of sense of achievement for kids or even for adults. That sense of achievement comes in forms for kids in grades, in access to accolades. For adults, that typically translates into a paycheck or continued employment. So if we start to look at what are some of the signs and symptoms of suicide that we need to be aware of during any time, but specifically during a pandemic, talking or wanting to die or wanting to kill oneself. Themes, either written, verbal, drawing. Talking about feelings of emptiness, hopelessness, or having no reason to live. Making a plan or looking for a way to kill oneself, such as searching for lethal means online, stockpiling pills, buying a gun, buying a ligature to bring about strangulation. Talking about great guilt or shame. Talking about feelings of being trapped or feeling like there is no solution. Feeling unbearable pain, and that can be either emotional and or physical. Such things as talking about being a burden to one's family, to society. Changing the way that a person uses or does not use alcohol or other drugs. Maybe increasing the use or starting the use of. Acting anxious or agitated, more so than usual. There may be a withdrawal from friends and family members. There may be a change in their eating habits or sleeping habits. They may show rage or talking about seeking revenge. Talking about risks that could lead to their death by doing risky behaviors, driving fast, taking more medication than need be. Talking or thinking about death more often than usual. Displaying extreme mood swings, such as changing from being very sad to very calm or very happy. Again, rapid mood swings. Giving away important possessions, or even saying goodbyes to family, friends, and even putting affairs in order, making a will. Now, I'm not saying that people who make a will are suicidal. I'm not saying that. But one of the other things that we need to be aware of, these are signs and symptoms of suicide that we can detect a lot more easily. There are some more spontaneous suicides that come about when there may be some sort of significant embarrassment, ridicule, or severe hopelessness. Now, while suicide is surrounded with helplessness and hopelessness, where the person sees no hope for them getting any better, and they don't see any help out there in the world that could assist them. when a person encounters a sudden situation in life where there may be significant ridicule, embarrassment, or even the possibility of protracted death, sometimes they may choose to end their own life. And again, those are more difficult to detect, and those are typically referred to as spontaneous suicide. So realizing that folks who may be diagnosed with COVID-19, and specifically if they have some of the known pre-existing conditions that can put them at higher risk, then we may want to keep in the back of our minds, might they be suicidal? Might we need to keep a check on that and ask them how they're doing, checking in on them more frequently, because of the possibility of them seeing no way out. There's a number of other resources available to address suicidality on the website, partnersinternational.com, on the COVID-19 tab. And you all can take a look at those extra resources as well. Along with the website, partnersinternationalinc.com, there's also a lot of resources there for children of various age ranges. Some of the children's books that have been put together that you can download to help explain COVID-19 to the kids. There's going to be updated versions of those. So be sure to keep check of the websites where those children's resources have originated from. Let's take a look at coping skills, and because that's very closely tied to beliefs. In looking at coping strategies, I actually did my master's thesis on looking at coping mechanisms and defense mechanisms, and basically was able to do some research to show that, yes, in fact, those are actually distinct, different kinds of coping or different kinds of mechanisms at play. Coping mechanisms, as opposed to defense mechanisms are ways of viewing life, of living life, that are by and large subconscious, that they are, we don't have readily access to them to conscious awareness. With coping strategies, they are in conscious awareness, and there's some interesting coping mechanisms. The ones that I was used to working with back in the 80s has been updated, and I'll have to say I like the more current nomenclature much better than the older ones. But some of the more recent nomenclature for coping mechanisms are divided into some various groups. One is appraisal-focused coping strategies, and this is when a person modifies the way they think, such as employing denial, distancing themselves from the problem. They may also look at goals and values, or they may see humor in situations. Now, again, those are some of the appraisal-focused kinds of coping mechanisms. Some of the adaptive behavior kind of coping strategies, this is where people are finding out information on the problem and actually learning some new skills to help manage the problem. Again, an adaptive quality to that. There are also emotion-focused kinds of coping strategies, and these involve such things as releasing pent-up emotions. In popular terms, it's called venting. Distracting oneself, managing hostile feelings, or even meditating. There may be the utilization of mindfulness and even relaxation techniques. The goal here in managing the emotions that accompany perceptions of stress, here it's a different way of looking at things. It's addressing issues. And some of the ways that the emotion-focused strategies are implemented may be such things as disclaiming. Sounds a lot like and has qualities of denial. Escape or avoidance also are some of the characteristics. While other folks may manifest accepting responsibility or accepting blame. Exercising some control over a situation. That sounds a whole lot like owning and seeing that they have choices. And then also positive reappraisal, looking for the positive aspect of a potentially negative situation. Now, some of these emotion-focused coping mechanisms actually are designed to alleviate, if you will, some of the distressing qualities by maybe even minimizing, reducing, or even preventing some of the emotional components of a stressor itself. Such things as seeking emotional support or outside social support. Reappraising the stressor in a more positive light. Recouching, if you will, seeing it from a different perspective. Accepting responsibility, using avoidance, and even exercising some self-control, and even distancing. Now, you may notice that these emotion-focused mechanisms, they have some positive and some negative qualities to them. They do. So looking at some of the reactive and even proactive kinds of coping skills that folks can manifest, some of those categories include social coping. Now, in looking at social coping, it recognizes that the individual, they're embedded into a social environment. And in doing so, there's going to be some resources that are available because of that association, that membership, if you will. And even just simply being a member can be helpful. Looking at another coping mechanism that can be both helpful and harmful, and that is looking at humor, the use of humor. Now, initially, there were lots of thought that said that humor needed to be light humor that was non-offensive, that the use of dark humor that could be taken the wrong way or that could be offensive to folks was not helpful. Well, unfortunately, some research more recent has found out that that is not in fact the case, that humor is helpful, but it has to be in the right context. That humor within, let's say, emergency services can be really quite crass. That humor can be helpful in emergency responders, but it needs to be kept inside emergency responders populations because it can be highly offensive to the general public. So again, realizing that humor does play a part in coping, it brings about the body's natural opiates, the endorphins, and it doesn't matter if it's light humor or dark humor, humor is humor.
So
context.
one of the things that I've learned about humor is some of the underlying evolutionary mechanism is driven by recognizing a threat and then having the threat not be an active threat, essentially. So like tickling, part of the reason why tickling makes you laugh and sort of activates that circuit in your brain, the sort of humor laughter circuit, is that your vulnerable parts of your body are being exposed, but it's that exposure is not causing harm. So you're recognizing that there's a threat to your vulnerable parts of your body, but that threat is not being activated. So the person who is doing this is not threatening you, but they have the potential to threaten you. And so it's this recognition of the potential, but then the non-activation of it, which allows you to sort of process it and provides part of the link to play that causes the tickling play fight, is sort of building that awareness so that you can have, you recognize where you're vulnerable, but then also recognize how to defend it, but also recognize that the fact that you're vulnerable does not mean that you are invulnerable. Like your vulnerability is not, does not make you vulnerable, right? And so that I find the chain of that very, very interesting and good knowledge to have about the way that this whole process of psychology and humor works.
In talking with one of my colleagues that's a massage therapist, it was interesting, our discussion, because from his perspective, humor or tickling has much more to do with a pain response, physiologically. So anyway, so looking at some of the maladaptive or non-coping capabilities, some of the maladaptive behavioral strategies, such things as dissociation. Dissociation is when a person regresses to a prior level of functioning. Now, many times a dissociative event may come about when an event is too overwhelming for a person to process, to conceptualize. So they may dissociate, have out-of-body experiences, or regress to a prior level of coping. That's why many times there may be some infantile reactions to trauma. There may be sensitization, there may be safety behaviors, rationalization, anxious avoidance, those sorts of things. So to unpack some of this, sensitization actually is when a person seeks to learn about or actually investigates something more so to decrease any anxiety. Safety behaviors many times are demonstrated when people with anxiety disorders come to rely on someone or something else as a way of providing coping for them, for their excess anxiety. There may be some rationalization, and with that, it's more of a way of minimizing the severity of an incident. The term anxious avoidant is typically when a person avoids any sort of anxious situation by whatever means they can have access to avoid it. And that can actually get into some really creative manifestations too. So if we take a look at how to go about operationalizing, if you will, some of these coping mechanisms that seems to be really quite cerebral. Taking a look at the positive aspects, such as addressing things proactively, looking at immediate problem solving, not waiting. Looking at root cause analysis is a term from not too distant past. Benefit finding is another way of doing that. Looking at spiritual growth, finding ways to turn a problem into a way of growing spiritually, to have, if you will, post-trauma growth, to have more awareness or insight into the aspect of being human. Some of the mechanisms that can actually help contribute to positive coping, being able to adapt, being able to be both cognitively, behaviorally, and even spiritually flexible, being able to adapt. Aim inhibition, being able to lower one's sights so that a goal can be attained. It may not be the goal that you would ideally want, but you can still have some goal attainment at a lower level. Looking at some other manifestations such as altruism, looking to care for others. There's also compartmentalization, putting things in a box emotionally, cognitively. Compensation, basically making up for a weakness by focusing on another area, gaining strength in other areas. One that is really quite primitive, but works really well, and that is emoting, crying, letting off some emotional pressure. Folks in the past have said such things as water from the eyes keeps the head from exploding. Being able to, this is an old psychoanalytic term, but the term is sublimate, and that is channeling basically psychic energy into a more appropriate or acceptable kind of activity or belief. There are ways of using substitution as well that can be helpful. Some other positive manifestations of these coping mechanisms include such things as meditation, stretching, progressive muscle relaxation, listening to music, getting some exercise, aerobic exercise. And the reason that exercise is so very important is that as we're having the fight or flight response, as we get more information, more statistics from COVID-19, we're having adrenaline dumps because we're scared. We're frightened about this. So we have all of this adrenaline pumping around in our blood system with no way of releasing itself. So with that increase in adrenaline comes cortical inhibition, which leads to our inability to focus, our cognitive decline. So exercise burns off that adrenaline and the cortisol and the subsequent cascading neurochemicals and hormones. So exercise is a wonderful way of allowing ourselves to refocus by getting adrenaline out of the way. Watching movies, escapism. Reading, again, a type of escapism. Giving ourselves a time out. Working on puzzles or playing games. Again, these are wonderful ways of escaping in a more healthful way. Going on walks. Again, getting a different perspective, seeing something outside of the four inside walls, that can in and of itself be helpful. But going for a walk, again, is going to be exercising and burning off adrenaline. Likewise, spending some time alone. Spending some time with your own thoughts is going to be helpful so that you can do some of your own metacognition, thinking about what do you think about the situation. giving these various data points that you have collected through however you collect information, which is another discussion in and of itself. How do you make sense of these data points that you have allowed to come into your life? How do you make sense of it? Or do you allow someone else to have control over that by looking to their social media feeds, by looking at their commentaries? Do you allow them to make sense of it for you? Or do you figure that out for yourself? Again, how much control do you want to give to others? And how much do you want to manifest for yourself? Possibly relaxing in a steam room or a sauna, going fishing or hunting, having a hobby that takes your mind off of COVID-19. Again, some helpful kinds of escapism can be very helpful. There can be some sensory coping skills that can be extremely helpful. Getting some fresh air, being able to snuggle under a cozy blanket, having that sense of comfort, listening to running water, as long as that doesn't make you have to go to the bathroom. Being able to appreciate aromas that are pleasant, such as aromatherapy. Maybe taking a warm shower, a warm bath, or getting a massage. Maybe even just simply changing your view and appreciating the view out your window or out of a different window. All of these sorts of things you can do for yourself. There's also other kinds of pleasuring activities, such as gardening, watching a movie, journaling. There's such things as ways of helping to get your thoughts in order, such as making a list of things that you want to accomplish and then checking them off. Immersing yourself in maybe a crossword puzzle. Maybe attending some sort of spiritual activity. Maybe meditating, which is, by the way, a generic form of praying. But simply being mindful of where you are and what you're hearing. It's another way of kind of giving yourself a timeout so that you're not stressed by the current stimuli. Trying yoga, doing Tai Chi, or maybe even taking a nap can be helpful. Engaging in some hobbies that, again, take your mind off of the current situation and giving yourself a bit of a time out from the stressors of things that are going on. From some of the research that has been coming out since COVID-19, I wanted to share with you some of the outcomes there. This comes from an article called from Brain Behavior and Immunity, and this is from an article called COVID-19 Suicides, a Global Psychological Pandemic. This was published in April of 2020. And in dealing with the stress of COVID-19, this article talks about limiting your access to news, specifically COVID-19 news, and only getting your COVID-19 news from sources that you trust that are reputable, such as the World Health Organization, the Centers for Disease Control, or even your local health department. As well as the third component that they make mention of as being extremely important, and that is maintaining connectedness, social connectedness, extremely important.
So Sam, I think speaking of social connectedness, one of the topics on our list to get to is civility. And perhaps we can bring the social connectedness to civility, and go from civility to COVID fatigue. And I think that will close out most of our discussion. So yeah, the civility point that you wanted to cover.
Sure.
Maybe this will be part of that segue or not, but with coping, I know we're talking about the suicidality and the increase in that, but one of the other things that I deal with and work with emergency services, et cetera, are increases in domestic violence, spouse, child abuse, et cetera, because of the stress the family is under from COVID or conditions related to COVID.
Exactly. We're also seeing an increase in child abuse, and it's particularly concerning because the typical reporting mechanisms aren't in place through school systems. But so if we're seeing an increase, it has to be a real significant increase because it's not coming through the traditional reporting avenues. So yeah, and so looking at civility, there's been actually quite a bit of talk around the concept of civility or the lack thereof during COVID-19 and even in the civil unrest and even in the political arenas as well. And let me just say that and I've actually used this example for a number of years before all of this took place, and that is the Jerry Springer Show was a television show designed for entertainment. It's not reality. It's a television show that was designed to generate viewership so that products could be sold. It was not intended to be a how-to course on how to live life or how to cope with life or how not to cope with life. So looking at a definition of civility, what is that? And a consensus of a number of definitions basically is that it's a way of showing regard for others by being polite. So if we kind of tease that apart, so what does, if we look at the Latin part of that, it's relating to public life, befitting of a citizen. So what does this politeness have to do with anything? And why do we need to be civil? And this harkens back to some concepts that originate in early childhood. And it comes from the concept of environmental mastery. We need to, as an infant, we need to feel comfortable enough in our environment in order to be able to function in that environment. We need to know what to expect. And it is through civility that we bring cognition to chaos. That without civility, we simply can be quite barbaric. So if we can bring cognition to chaos and some order to chaos, then civility helps us to give some expectations, some parameters to how to interact with folks. Now, some may say that we don't need to go to the extreme of what is portrayed in many movies as the stiff British kind of civility. But at the same time, it does give a sense of order. It gives a sense of stability. It gives a sense of what to expect. I want to also to share with you a story that Anton Chekhov actually wrote a letter to his brother, who apparently had some real difficulties coping with adulthood. And in this letter, he basically told him that he needed to get his life together. And in this letter, I'll be quoting from that. Number one, they expect the individual and are therefore always indulgent, gentle, polite, and compliant, respecting the individual. They do not throw a tantrum over a hammer or a lost eraser. When they move in with someone, they do not act as if they're doing them a favor. And when they move out, they do not say, "How can anyone live with you?" They excuse noise and cold and overdone meat with witticisms and with the presence of others in their home. So it is based in respect. The second point that he makes is their companion extends beyond beggars and cats. Again, a further explanation. They are hurt even by things the naked eye can't see. For instance, Petrov knows that his father and mother are turning gray and losing sleep over their son so rarely. Then when he rushes home to the parents and sends his vodka to the devil. A third component that he talks about is they respect the property of others and therefore pay their debts. The fourth one, they are candid and fear lies like the plague. With that, he goes on to say that they do not lie even about the most trivial matters. A lie insults the listener and debases him in the liar's eyes. A fifth issue that he brings up, they do not belittle themselves merely to arouse sympathy. Number six, they are not preoccupied with vain things. Number seven, they have talent and they respect it. And they cultivate their aesthetic sensibilities. So again, this has a bit more formal sounding and resonations to it. But looking at how can we embrace civility to help bring about some cognition to our chaos. We've got enough chaos with COVID-19 without making things worse by not being nice to one another. Thoughts or comments?
It sounds
Well,
like a Tom Cruise movie, Mission Impossible, going into an election year.
I could throw in briefly some complexities here without being that person too negative. The World Health Organization and the CDC a little bit in all this have sacrificed a little credibility at times as we've gone through the pandemic. And that's been unfortunate, particularly when we try and then weigh that against the advice to limit our exposure to too many different conflicting news sources and find some places that we trust, because then that puts us in conflict with the advice not to delegate our thinking to others, which I think is very sound advice. That's one tension. Another interesting tension, and only as problem statements, maybe for the group to chew on, or you, Sam, to comment on. I feel like there's a bright line somewhere in not making personal attacks, and yet also, and tremendous value in this current concepts of political correctness, but then that can move into when is it a capacity to be offended rather than a capacity to offend? Where is the line from microaggression into micro easily offended? and how we define that. And I'm looking at another screen. This just over social media created an interesting firestorm or debate within the last few days. Among the community of vascular surgeons, someone had published a study of unprofessionalism or lack of professionalism in social media by young vascular surgeons. And one of the defining definitions for that unprofessionalism they gave as controversial political opinions. And I thought that was a very interesting tension and debate. With those thoughts, I'll mute again. Thank you.
Is there any political opinion that is not controversial at this point?
Probably depends on where you sit.
Exactly. So I think that we've kind of been we've been talking for a while. We're at almost 3 hours of this. I think it would be good to go into COVID fatigue and then a bit of an open Q&A, so that we can wrap this up in maybe half an hour to 45 minutes.
Okay.
There's so much information to go over that this was
It really
going
is.
to be a long talk from the beginning. But I think we are about at stamina limit, and it is getting, I think it's midnight on the East Coast, so
Yes, it is.
it's getting
Actually,
quite late.
18 after.
So
11:18
ahead.
Central.
So looking at COVID fatigue, in relation to what's going on in our current lives, before all of this, we had work, we had home life that we were dealing with. The stress levels were as they are before, pre-morbidly. And then this comes up, this pandemic that adds two things exponentially. And I want to share with you a quote from the guy who started the concept and the dialogue on compassion fatigue, Dr. Charles Figley. In 1995, he actually said, "We have not been directly exposed to the trauma scene, but we hear the stories told in such intensity, or we hear similar stories so often, or we have the gift and the curse of extreme empathy, and we suffer. We feel the feelings of our clients, we experience their fears, we dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We are sick, but we aren't ourselves." And I think that not just for those in the helping professions, whether it be the medical or the mental health, but in teachers specifically, is one population that is highly susceptible to compassion fatigue, because we're hearing the stories of others. In the news now, we're hearing the increasing statistical numbers of people who are dying. We're continually bombarded by those numbers. And we do have empathy. I think we are realizing that. And because there's so much death associated with this, that we are becoming a bit, some are becoming jaded, some are becoming numb. So we need to acknowledge that. We need to address that and to help folks process what they're doing. With the COVID fatigue that comes about through whether it's watching news reports, whether it's hearing actual stories from family members or neighbors, we're susceptible. It has come home. And the times that we would just simply see it on the news, we could put some distance between us and that. But many times now it has come home to us. We can personalize it, whether it be family members, whether it be colleagues, and even we can identify with some of the folks on the television screen, because we go to work just like they went to work. We have children just like they have children. We can identify with their situations in life, and therefore that makes us susceptible. There are some things that can increase our risk of developing COVID fatigue. One is if we have some depressive or sadness already going on in life. If there are some extenuating circumstances that are limiting our coping skills. If we're having a sense of instability from Maslow's hierarchy of needs kind of perspective, that can put us at risk as well. So some of the ways that we can combat compassion fatigue or COVID fatigue is by doing the things that I've already been talking about, that we've already heard on the news. Limiting your access to COVID news. Hearing about the statistics going up 10 points each time you tune into the news report on the next hour, that's not going to help anything. Deciding when you're going to get your news for the day, whether it be in the morning or the evening, and let that be it. And go out and live life so that you can have a perspective of life, not just life during COVID. Being able to get outside of the COVID lifestyle by engaging in hobbies, by interacting with folks and not talking all the time about COVID or the civil unrest. Being able to maintain boundaries as we're supposed to be doing, but also maintaining some boundaries in how we interact with folks. What do we know about civility, and what are some topics that we typically stay away from even before COVID-19? Politics and religion. And what are we facing right now? Politics and religion. So being very careful about how we go about what we're choosing to participate in life, what we're choosing to have a part of our life is going to be really important so that we can have as much choice in our life as possible, as opposed to allowing other folks to have choice in their life. Some of the self-care strategies that I've already talked about in coping, but can help out, and that is maintaining connections is the biggest one. Maintaining social connections, social support systems. It may not be optimal right now, and it may not be optimal for a while, but that's okay. We can still cope. We can still do virtual hugs. We can still have hugs with our pillows. We can have that same kind of sensation, although it's not with another human being or the human being that we would like. Realizing that this is a relatively temporary situation, that as soon as we have some vaccines that are available, that we're going to be able to readjust to what our lives are going to be progressing into. Now notice I stayed away from that term that folks tend to focus on, and that term is the new normal. Right now, there's nothing normal about this. There's nothing normal about what we're going through. But in the larger picture of things, it actually is normal. For a pandemic, it's moving along the trajectory, the life cycle, as we have known other pandemics to go through. It just doesn't feel right for us right now. And that's okay. We don't have to like it, just like we didn't have to like our broccoli or asparagus when we were younger. We just had to go ahead and deal with it and eat it or pacify our parents. Right now, we don't have to like it. We just need to get through it. And by getting through it, sometimes we have to acquiesce and say, okay, even though I don't like it, I'm going to eat the broccoli anyway. It's okay to acquiesce so that the majority of folks that can survive COVID-19 can survive COVID-19. Realizing that as we meander our way through this, that we can look forward, for some folks, to post-trauma growth. We can look forward to having a deeper sense of meaning in life for having gone through this. We may not realize that right now, and not everyone's going to be able to do that. But for some of us, we're going to be able to do that. But also realizing that some of us are not going to be able to have that. And we may actually be somewhat casualties of the event, meaning that we're impacted in a way that we can't get back to normal. But we're still going to be able to have some sort of semblance of life together. There's lots more we can talk about concerning compassion fatigue. I've tried to focus my comments on things that are more specific to COVID-19 than generalized compassion fatigue. And in essence, what I'm wanting to articulate for folks is that it's so very important that we find ways to manifest distress tolerance. We may be experiencing lots of distress in life right now, and it's okay to not like it. We don't have to act out because of it. There are ways that we can augment our life to help us tolerate this distress until we can move through it. It's called coping. It's called working together. It's called realizing that we do have the capability of regulating our cognition, the way we're thinking about things, and we also have the ability to regulate our emotions of how we think about things. One of the easiest ways to go about doing that is perspective taking. One of the things that I think that I learned more from than many times college or graduate school is when I was a student ambassador when I was in high school. Spending 2 summers in Europe and Asia and being immersed in various cultures with other kids that were about my age in the various cultures, and I got to live in their house. I got to live in their culture for like a week at a time. Realizing that, yeah, it was different. It was totally different than how I lived. But I was able to learn from it. I was able to embrace the uniqueness of this and to learn from it. To realize that we were basically achieving the same goals. We were just simply getting there in a different way. We were all eating. We just ate different things. Some things I didn't really care to eat, but that's another point. But being able to adapt to, tolerate temporary distress can actually bring about on the other side an awareness that we couldn't have achieved without that distress. It's very much like what happens to dirt and stuff when it's compressed for a long time. Cold compressed turns into a diamond. And I think that if we can focus on how the pressures that we're underneath right now with the COVID situation, with the racial unrest, with the political situations, with whatever, with those pressures, how are we going to turn that pressure into diamonds that are much more valuable than what they started out to be.
Thanks, Sam, for giving us your time and knowledge. Thanks to everyone for sticking around for 3 whole hours and more of COVID and psychology.